Welcome to Hands on Health, the podcast all about living your healthiest life on the coast. I'm Felicia Struve, and today I'd like to introduce you to Emma Todd. Emma is a physician's assistant. She recently joined the CMH Primary Care in Astoria, Oregon. Join us as we meet Emma and learn about her approach to helping patients achieve their healthiest selves. Today I'm sitting down to meet with Emma Todd. She is a new physician's assistant at Astoria Primary Care. Welcome,
Hi,
Emma.
Felicia. It's nice to be here with you.
Yeah, it's nice to be here with you. So tell us first where you came from.
So I moved here from California, where I was also working at a critical access hospital, much smaller than CMH, practicing primary care. I was just outside of Yosemite National Park, and I was there for about 2 years. Prior to that, I was living in Baltimore, Maryland, which is basically where I grew up. I went to PA school just north of Baltimore City and ended up taking my first job in Baltimore. And so I practiced there for 6 years before I moved to California. I worked in neurosurgery, general surgery, and urgent care before transitioning to primary care.
So what made you choose primary care? Because it sounds like you were working in some pretty intense situations.
I was, and I really loved different things about each of those jobs. My first job out of school was with a solo practice neurosurgeon. We were doing all spine surgeries, and I had the opportunity to follow patients for a long time, sometimes up to 2 years. And so during that time, I built these longitudinal relationships. I really got to know the patient, and they got to know me, and I really liked that a lot. When I transitioned to general surgery and urgent care, I lost that. And at first, I didn't know that that was something I even cared about until it wasn't there anymore. And then I realized that I really missed that aspect of practice, knowing the patient and having them know me and having that easy rapport. So it was, honestly, my career has been a thing that's developed over time, right? Because when I graduated and I took my job in neurosurgery, I thought, oh, surgery is the only thing I ever want to do. And then after doing that job for 3.5 years, I got worried that I might be pigeonholed and wanted to expand on my knowledge and my skills. And that's why I transitioned to general surgery at that point. And then in that job, I realized that actually I wanted to do more medical diagnosing. When you work in surgery, you basically do essentially what the surgeon says, depending on where you work. But I mean, that's just, a general overview. So there isn't a lot of real independent decision making, which is not how physician assistants are designed to function. Really at the heart of it, we are trained as independent practitioners, even though we practice under a supervising physician. So what that means is technically my training allows me to see a patient, come up with a diagnosis and a treatment plan all on my own. When you're working with a surgeon, you don't really get to do that. They really come up with that diagnosis and that treatment plan, and you are sort of an extension of them. You help them carry that out. And nothing against that, but I just wanted more. I wanted to challenge myself and push my boundaries with respect to my medical diagnosing skill set, which is what led me to urgent care. And then in that time frame of general surgery and urgent care is when I really realized, okay, I like doing more of the medical diagnosing. I like having a little bit more independence than I had when I worked in surgery, but I miss having those longitudinal relationships. And so then I was like, oh, well, primary care will probably allow me to have more of that. And so that was kind of what led me to primary care.
Yeah, it sounds like you've been finding your fit.
Exactly. Yep.
So you've been at CMH Astoria Primary Care for just a few weeks.
2 weeks now.
Good. How's it been going?
Yeah, they're breaking me in easy.
Good.
So.
Good. What have you found is different about working in primary care?
Compared to like urgent care, you mean, for example?
Yeah, which I guess is a kind of a tricky question since you've probably only seen most of your patients once at this point.
Um, I would say, honestly, the biggest difference is that you're really caring for the whole person. In urgent care, it is truly episodic in nature. And so, whatever that problem is at that moment that they need you to take care of, whether it's an ear infection or a urinary tract infection or back pain or whatever it is that they have going on, you really deal with that one problem and then you send them out and anything else that they need. So, like, let's use back pain as a good example. When I was in urgent care, we had x-ray capability in our facility. So I might order an x-ray on a patient and send them out with some pain meds or like a steroid taper. But then ultimately they would follow up with their primary for physical therapy or an MRI. So you're just dealing with one defined problem. Whereas in primary care, you're really expanded in terms of like the care that you're administering and then also the whole diagnostic process. Often the problems that patients having are way more complex to diagnose because there's, all different kinds of systems that might be causing a problem. And it's really your responsibility as primary care to get to the bottom of all of that, and not just kind of like do the initial workup, make sure that the patient's, not going to die when they walk out the door, and then you send them on their way.
Mhm. Yeah, so it's a different approach and a different, goal.
Yeah, it's really more about, in my mind, it's more about taking care of the whole patient, making sure that they're managing their health over their lifetime and building that relationship with them so that you can partner with
Mhm.
them in that.
So if you were going to give, a general patient, let's call her Jane Smith, some advice, what are the 3 things that Jane should focus on to be a healthy person throughout her life?
Oh, I think the number one is don't smoke. That's the biggest one. I could harp on that all day. It really is the one thing that I tell patients over and over and over again. If you just want to do one thing for yourself that is going to make you healthier, it would be to quit smoking. Outside of that, I think getting some sort of physical activity most days of the week. So I would say 5 days a week is probably a good guideline. And that's going to look different for different people. Someone who is exercising regularly, maybe they're going to be doing, something more intense like high intensity interval training or CrossFit or, you know, running sprints and hill repeats. Like maybe they're doing that 5 days a week, whereas someone who's just getting started, maybe they're just out there, taking their dogs for a walk and it's more leisurely, but you're still getting physical activity and you're building that practice, which I think is really, really important as well. And I would say I'm going to put sleep/stress relief into the next category. I think that that's also really critical. I think our society undervalues time for yourself, time to decompress, and the importance of sleep. When we're sleeping, so many important physiological or body maintenance processes happen. So hormones are regulated while we're sleeping. Repair inside the body. So like things healing themselves, that all happens while we sleep. And so sleep is really critical.
So it sounds like at the heart of it, it's good
Yes,
habits.
exactly. Good habits.
All right. Well, thank you for taking the time to join us today and welcome to Columbia Memorial
Oh, thank you
Hospital.
so much, Felicia. I'm so thrilled to be here. It's such a gift. And this area is beautiful. And I can't wait to get to know all of you and all of my patients better and help people along in their journey to wellness.
Well, we're glad to have you.
Oh, thanks.
Thank you for joining us today. I'm Felicia Struve, and this has been an episode of Hands on Health brought to you by Columbia Memorial Hospital.